The Dartmouth-Hitchcock Heart and Vascular Center provides state-of-the-art services in clinical cardiology, advancing frontiers of knowledge in cardiovascular medicine and training the next generation of heart and vascular experts. February is Heart Month, and Dartmouth-Hitchcock wants you to know about your heart health. This is the fifth in a series of podcasts called Get Heart Smart. Dr. Mark Creager, Center Director of the Dartmouth-Hitchcock Heart and Vascular Center and President of the American Heart Association, joins us today to discuss venous thromboembolism, or VTE. VTE is a disease that includes both deep vein thrombosis, or DVT, and pulmonary embolism, or PE. Dr. Creager, thank you very much for taking the time to join us today.
Thank you very much for having me.
Can you describe what venous thromboembolism is?
The term venous thromboembolism, which is sometimes abbreviated VTE, really takes into account two closely related problems. The first is venous thrombosis, and the second is pulmonary embolism. Venous thrombosis is when a clot develops inside a vein, typically a vein of the leg, and a pulmonary embolism is when that clot leaves the leg, travels up the main vein through the abdomen and the chest, goes through one side of the heart, and then lodges in the lungs. The word for lungs is pulmonary, and the embolism is a clot that has moved from one place to another.
How common is VTE?
VTE actually is quite common. It affects anywhere between 1 and 2 per 1,000 adults living in the United States. So knowing the population of the United States, it calculates to about 300,000 to 600,000 people each year. One of the important points about pulmonary embolism is that it can be fatal and actually contributes to over 3% of cardiovascular-related deaths in the United States each year.
And what are the risk factors associated with it?
So venous thromboembolism is associated with a number of risk factors. These include oral contraceptives, the use of estrogen in postmenopausal women, pregnancy, and others such as hospitalization where someone would be at a prolonged bed rest, different types of surgery, particularly orthopedic surgery like hip and knee replacement, trauma, and importantly, cancer. In addition, some people have clotting disorders that they may have inherited or acquired later in life that puts them at risk for developing blood clots in the veins of their legs and therefore deep vein thrombosis and pulmonary embolism.
And when should someone be concerned if they have DVT or PE?
Well, that's a very important question. So in terms of deep vein thrombosis, where a clot forms in the veins of the leg, the symptoms would occur in the leg. So an individual, particularly one who has the risk factors that we've discussed, for example, they may have cancer or they have been taking hormone replacement therapy or have been a prolonged bed rest for a period of time, they might develop symptoms in the legs that should increase their concern about deep vein thrombosis. And those symptoms are discomfort, often in the calf, sometimes in the thigh, and importantly, swelling. So if one leg has begun to swell in an individual who had been a prolonged bed rest or had been sitting for a long period of time, such as on an airplane traveling from the United States to Australia, or on someone who is taking hormone replacement therapy, that should raise concerns that they have a deep vein thrombosis or DVT. Pulmonary embolism, so that's when the clot has traveled from the leg veins to the lung. Those individuals would get symptoms such as difficulty breathing, often of rather sudden onset, and they find that they can't do what they typically would be able to do, even climbing a flight of stairs, without getting short of breath. Or they may have chest pain, and the pain that they would experience is often sharp, and it gets worse when they take a deep breath. And in individuals who have these symptoms, particularly if they also have swelling in one leg, that really increases the likelihood that they have a deep vein thrombosis and pulmonary embolism, and they should seek medical help urgently.
What is the most important message that you can tell people that may be at risk for DVT or PE?
If deep vein thrombosis and pulmonary embolism is recognized, diagnosed, treated early and effectively, then the chance of the patient doing well is very good. But failure to recognize these and failure to get adequate treatment could have devastating consequences, including, in some unfortunate circumstances, death.
Dr. Creager, thank you very much for joining us today and providing heart-healthy tips and information on venous thromboembolism.
It was my pleasure. Thank you for having me.
For more information or to attend a Get Heart Smart event in your area, please visit d-h.org/heartsmart. Thanks for listening.